Okay, and then I will start the webinar.
Hello, everyone. Good morning for some of you, good afternoon for others. It's good to see everyone, some familiar faces and some new faces. So we're going to go ahead and get started. We have an action-packed hour for you here today. Just want to start off by saying thank you. Thank you for being here for this Prevention Perspective webinar series. Today's presentation is entitled Taking a Public Health Approach to Prevention. My name is Rana Yablonsky. I'm the Senior Director of Prevention here at Safe Project. I'm going to cover a couple of logistics and some housekeeping things for today's webinar. First, following today's webinar, you will receive an email with a link to the recording that you can share with others. We invite you to do so. Although the presentation does not qualify for continuing education credit, those who are in attendance at the live webinar will receive a certificate of completion. During the presentation, our presenter will be asking several times and sharing reflection questions. We ask that you respond to those reflection questions in the chat or using the chat feature. For your individual questions and your more personalized questions, we ask that you post those in the Q&A section. At this time, I want to move in and offer an introduction to Safe Project. Safe Project, and followed by Safe Project, I will then give you a bio of our presenter. All right, so in this visual image of Safe Project, you will see a depiction of the organization as a national nonprofit. We are a 501c3 organization that was established in 2017 by the Winnefelds, Admiral James and his wife Mary, after the tragic loss of their son Jonathan at the age of 19 due to an opioid overdose. Safe Project is a nonprofit. We aim to save lives impacted by substance use and mental health challenges, doing so through overdose prevention and response, education and efforts to combat stigma, as well as through the development of prevention and recovery programs. Here at Safe Project, we provide tailored guidance and training through 4 key initiatives, again listed there on the screen. You can see Safe Campuses, which is colleges and K-12 schools, Safe Communities, Safe Workplaces, and Safe Veterans. Each of these initiatives then fueled by 6 lines of operation. To learn more about Safe Project, you can visit our website at safeproject.us. Now, at this time, I'd like to introduce you to an esteemed colleague, and it's a genuine honor for me to make this introduction to Cindy Chaifetz. Sydney is the Deputy Director of Safe Campuses. Sydney brings over 9 years of experience in international public health, collegiate recovery, health education, and disease prevention to the field. In her current role, Sydney builds and oversees Safe Project's developmental programs working to create learning, advocacy, and leadership opportunities for students nationwide. All of this efforts rooted in public health, health equity, empowerment, and public health principles. Prior to joining Safe Project, Sydney led prevention efforts, harm reduction and recovery programs at Gonzaga University. Additionally, she has served in the field of global health and education in Brazil and on the polio eradication initiative in Nigeria, where she used public health research to control the spread of infectious disease. Sydney holds a Master of Public Health from Oregon State University. She is certified in motivational interviewing, recovery coaching, and ethical public health research. Again, with absolute pleasure and honor, I'm going to go ahead and hand this over to you, Sid.
Thanks, Rana. Hi, friends. I'm so excited to be here with y'all today. For the sake of time, let's jump in. Y'all, if you've ever been in a presentation with me before, you know that I do not want to talk at you for an hour. I also firmly believe that we learn best from each other. So there's a couple of opportunities today in the presentation where I really do want your thoughts. Please feel free to throw those in the chat. And then most importantly, if you have found a creative way of doing prevention across the continuum of care, if you found something that works really well, please do share that in the chat too, so we can learn from each other. All right, friends, what are we going to focus on during our time together today then? Well, first things first, we are going to, sorry, got to get my screen organized. We're going to redefine health promotion and substance use prevention goals. We are going to rethink substance use using the social determinants of health and holistic prevention perspectives. We're going to reflect on public health and reality-based approaches to prevention. And lastly, we are going to discuss community and individual level interventions, as well as primary, secondary, and tertiary prevention methods. Okay, friends, just a reminder here too that you have the Q&A feature for any questions that you might have. We have time at the end. Also, my email will be at the end if you have any questions or you would like some technical assistance from the team. But if you are going to write something in the chat, just make sure that it's coming through to everyone. There's the option for hosts and panelists and to everyone. So make sure that everyone can see what you're writing there. All right, y'all, let's jump in. First things first, while I was quickly looking at the signups, we have a diverse group, both of work and personal experience in this room. So I'm going to try my best to give examples for everyone. That includes different types of prevention for different life stages. With that said, though, there is a lot of us from various perspectives, and I want us to remember that prevention is better together. So all of our voices help us to understand the people that we aim to serve. So if you're newer to this work, I want you to take the lens and be thinking about what assumptions your work currently makes about what prevention is and what prevention isn't. Also, what gaps do we need to be filling? Let's say you're more experienced to this work. I want you to be curious, take a beginner's mindset, and then really be thinking about the new ways that we can practice prevention. And importantly, how can we pursue integrated support? All right, y'all. So first time, I want to hear from you. I've heard a little bit about this. Why are you in the session today? What are a couple of things that you hope to learn from today's session? And while y'all are typing that in the chat, looking at some of the responses that came in, again, they are quite diverse. So we have folks saying, I'm really new to the field of public health and I just want to learn better how to apply it to prevention. Or folks saying, I am a seasoned prevention professional and I just want to get creative about how I might be able to see it through a new lens. I love John here saying always willing to learn something new. I love that. Any other things, friends, you all would like me to hone in on a little bit deeper today? I want to see the public health perspective on prevention. Thank you, Angela. Yeah. Rachel says exposure to new trends in prevention. Absolutely. Y'all, we're going to go over all of this today. But again, I love that y'all have already started to put what you do and where you do it in the chat. If you're finding someone that's doing this work, maybe in a different population, but in a similar region to you, reach out, get connected to see how you can partner in that work. And then again, if you're doing some of this creative prevention work, please do share that in the chat so we can learn from each other. I'm seeing here too, let's see, I'm currently working, taking a public health approach to prevention. Oh my gosh, the chat just blows up all at once. I'm interested in growing my perspectives and being in the community. I would love new information with a public health focus. Here to support overdose and overdose abuse prevention with trusted partners. I love that. One of our friends that has ADAPT. Always willing to learn something new as the landscape is always changing and working with students 6th grade through 12th grade. Absolutely, Megan. Any information gained will help us in the crucial growth of our skill level, how to combine public health education and opiate outreach. Absolutely. And then I work with the public, so I'm trying to learn something new about prevention. Yay, friends. Oh, and then we've got a collegiate recovery here. Love that. All right, friends. So lots of different interests today. I am excited to jump in. Okay, first things first. What is public health? Okay, well, first I want to acknowledge that public health is an entire bachelor's degree or an entire master's in public health degree. So just for the sake of time, we're not going to have time to go over all of it today. If you're curious and you want to learn more about the principles, practices, the different focuses of public health, I really encourage you to do so. Also, feel free to reach out at the end via email and I can send you some of my favorite readings, or there's also a lot of institutions of higher education that have completely free coursework on public health. Okay, so let's talk a little bit about public health as a practice. So public health promotes and protects the health of all people and all communities. It relies on foundations of various ethics and principles. So I'm going to review some of the ethics and principles today. First one being, and these are in no particular order, but the first one being this idea of health equity and justice, right? So impacting those that are most in need first, right? So we can see an example of this when we did COVID vaccines, right? So we knew that certain communities were at higher risk of contracting COVID. And so we focused our immunization efforts on those communities first. So health equity and health justice recognizes that not all people have equal access to health. And therefore we focus what is needed to certain communities, and we focus on serving the most marginalized when they need it most. Okay, obviously public health, as with other types of medicine, works to do no harm, right? Not only do we want to do no harm, we want to be of benefit to the people that we aim to serve. Public health takes population-based approaches. So when we think about public health and how it looks different perhaps than traditional medicine, when you see a doctor or a nurse, these folks are often trained to meet people one-on-one, right? So they have one client at a time that they are focusing on. This looks different than public health, and that public health works across the population and across communities. We want to impact the largest amount of people possible. Okay, a core principle of public health as well is this idea of prevention over cure. So we recognize that it is much more effective. It also saves us a lot of resources if we can prevent various diseases or negative health outcomes from occurring in the first place. And then we recognize that doctors and nurses, these are the folks that work on the cure side or after a disease has already onset. But when you think public health, I want you to think prevention. Okay, public health is built on this foundation of the social determinants of health. I'm not going to go into this right now because we've got entire slides on it. Public health, a core value of public health is respect for autonomy. So not doing onto those, but working with folks to improve their own health and their own wellness, respecting that people have choices, and we can work with them to make more informed choices, but we shouldn't be making choices on behalf of people or communities. Also, public health is based on evidence-based decision-making. So this comes from epidemiologists or our biostatisticians, right? We are not assuming what we think we need to focus on. We are using data. So a great example of this is with our opioid epidemic. We can see what populations it's impacting, where and when, and then we can act accordingly. So using data to inform our practice. And then last but not least, public health is built on this foundation of health education and health promotion. So giving people the knowledge and the resources necessary, and then empowering them to, again, make these informed health choices. So to round this out, when you see someone wearing a seatbelt, I want you to be thinking of public health. When you see smoke-free areas, I want you to be thinking about public health policy at work. When you see a lack of, let's say, polio, for example, in our communities, I want you to be thinking about public health and disease prevention. So public health is all around us all the time. It's just often happening behind the scenes to keep all of our communities safe and healthy. So if public health does its job well, we are promoting the good, health promotion, we are preventing the bad, prevention, and we're doing it for everyone. So often no one really knows the way that public health is in action if it's working the way that it should. All right, friends. So we talked a little bit here about health education, health promotion. I want to define that for us now. So health promotion is really this idea of a multifaceted approach of empowering individuals and communities to increase their control over factors affecting their health to improve their well-being. This really goes beyond focusing solely on individual behavior change and encompasses these broader social and environmental interventions. And we're going to talk about what those look like. Some ways that we see health promotion in action is empowering people. So providing people with either knowledge or skills or resources so that they can make informed health choices. This also looks health promotion like creating supportive environments. So maybe this is modifying social or physical or policy factors that promote health in our communities. This can look like promoting healthy behaviors, right? So empowering people to adopt healthy lifestyle habits, whether this is eating nutritious foods or moving our bodies more regularly or avoiding tobacco. We are promoting healthy behaviors. And then we are reducing health risks. So a lot of this is identifying and addressing factors that increase a risk for someone developing a chronic illness. Some of these factors, and we're going to talk about these, but we know are poverty, a lack of access to healthcare. We know that stress greatly impacts and increases a person's risk of developing negative health outcomes. So when we think about health promotion, I want us to be thinking about how this happens in a wide variety of ways across our community. So some examples of this would be in school. I noted a handful of y'all working in K through 12 systems. So in schools, school lunch nutrition programs, right? Offering healthy options for students to eat lunch at school. Under a public health principle, this also needs to be affordable, and then potentially providing some education to young people of what are more nutrient-rich options, right? And then making these accessible to folks. So in the school system, healthy lunch options. This can also look like sports programs or youth leadership programs. This is bolstering a young person's health. This is health promotion. In the workplace, there's many different ways that we can see health promotion in action. One way is employee assistance programs, right? So if your employee needs to see a physical therapist, we have a way for them to do that. If our employee needs to take time away because of their mental health, right, we have avenues in which they can do that. And also in our workplaces, we have a culture of well-being. And then just one last example in the community, right? So these are free resources in the community. Maybe this is at churches, maybe these are in public spaces. One example of this, I know sometimes walking in my neighborhood, there's a lot of parks nearby, and many of the parks will have accessible gym equipment. So kind of like those ways that you can move your body in a public space. This is a great example of health promotion in the community. Okay, I see Ruben here is adding a great option with health promotion is harm reduction. Absolutely, Ruben, and we're going to talk about that. Giving out naloxone, fentanyl testing strips, and resources, trainings on those, absolutely a great aspect of health promotion. Okay, y'all, I want to shift in here to talking about some traditional aspects of prevention. And with that said, I want to talk a little bit about seeing prevention through a new lens. So I've got another question for you. How many of you are thinking, when you think about prevention, and we're thinking about prevention for substance use, alcohol, and other drugs, how many of y'all think prevention is preventing use before it begins? You can just kind of, yep, that's me in the chat, or think to yourself. I'm willing to bet that this makes sense to a lot of us. This is likely a lot of us. Thank you, Alicia. Yeah. And this is because preventing use before it begins is one important aspect of prevention. And yet, how can we serve people, for example, who have already started using? How many of you are adults that have a moderate relationship with alcohol, for example? My point here is that prevention is about so much more than preventing use to begin with. It needs to be a lot more holistic than that. So I see some folks in the chat saying universal prevention, yes and no. It's also relapse and recovery support. Absolutely, right? So many of us know that prevention can be seen across the continuum of care to best meet people where they're at. Okay. I also want to point out that we need to recognize that the ways that people view prevention has to do with how they see themselves in it. So we can't impact people using prevention if people don't see prevention as being useful for them, or if they feel othered by some of our more historic prevention practices, right? Because potentially someone is past the point of needing primary prevention. How can we still use prevention that works for this person? So again, thinking about it much more holistically. Again, in the work that many of us do, we are working across the continuum of care. So working with prevention, harm reduction, and recovery. So it's increasingly important to be mindful in our prevention perspectives because we all know and love people who utilize harm reduction or are people that identify as in recovery. And we know that stigma cuts deep, right? Some of the things that we might say early on can't be undone later on in the continuum of care. And I'm going to provide some examples of what this looks like. All right, y'all, we got a big slide coming up and we're going to chat through the types of prevention. So before we jump into this, I just want to give the caveat here that substance use prevention comes from a much broader application of disease prevention as a whole. So really this original concept of prevention comes from a journal article in the 1950s that's about epidemiology and how doctors can work to prevent chronic disease. It has since been applied to various diseases, substance use disorder being one of those. But because of this, you might sometimes see prevention saying, primary prevention is preventing disease onset, right? What does that look like in the context of alcohol and other drugs? And we can see what that looks like here. So let's walk through primary, secondary, and tertiary prevention. You may have likely seen this in the prevention pyramid before, for example, sometimes thought of as levels of prevention. Okay, so primary prevention, keeping in mind that this is a type of prevention that impacts the largest amount of people, right? All young people in particular, we focus our primary prevention efforts on. So primary prevention under the realm of substance use is often preventing or delaying initial use through these proactive measures. So preventing use from ever occurring or delaying use from occurring. Some examples of this is education on alcohol and other drugs, right? What is the standard drink size? How does alcohol impact our brain, our body, our mental health, our physical health? What does cannabis THC levels look like over time, right? Giving people the tools necessary to make informed health choices. This is also early support. And we're going to talk extensively in a couple slides of what does this look like. But really, if we bolster people's well-being and we provide them with early support, that is such a wonderful way of practicing primary prevention. And then health promotion, right? A lot of primary prevention is bolstering health in the first place. Okay, so this is preventing use from starting or reducing or delaying use from starting. Then we shift into secondary prevention. So if primary prevention may prevent a lot of people from ever using drugs or alcohol, and that's great. And yet it's certainly not going to prevent everyone. Sometimes we see this across ages, right? Primary prevention might be historically used for younger folks, but it doesn't necessarily depend on a person's age or human development. We can see different types of prevention working at different life stages. Okay, secondary prevention focuses on early detection of and the reduction of substance use, right? So we want to be aware that someone is using substances and then work to reduce their use. And we do this in a couple of ways. So some important ways would be screening, right? Whether this is verbal or documented, how can we screen to know that people are using substances and in what ways? Early intervention, right? So whether this is conversations, motivational interviewing, we're going to talk about that in a little bit. But early intervention, once a person has started using substances, we are working under secondary prevention to reduce future use. So recognizing this is where a person is at now, and we can intervene now to either stop that use completely or to keep it where it's at, but not allow it to progress. And then certainly we are preventing high risk use. So use that is interfering with a person's goals, wellness, their job, their friendships, all of that sort of stuff. Okay, then we also see this other tier of prevention, this other type of prevention, tertiary prevention. So under tertiary prevention, we recognize that a person has started to use substances, and our focus here is reducing the harms that are associated with use and increasing a person's quality of life. So a lot of this might focus more on risk reduction, harm reduction, opioid overdose prevention, that sort of thing. So again, examples, harm reduction, access to treatment, access to affordable treatment is a great way of tertiary prevention working. And then access to co-occurring healthcare. Many of us know that oftentimes substance use disorder does not exist in a vacuum. It happens with many other either mental health conditions or physical health conditions that should be addressed as well. Okay, friends. So what we see then in primary prevention, again, is that we're predominantly focusing on bolstering well-being throughout education, reflection, and resources that we provide to prevent substance use from happening in the first place, right? So again, this potentially might be our focus for youth and young adults before they've started using. Yet, A stat that I have here shares that 64% of college students have used alcohol in the past 3 months. So over half of college students have reported having a relationship with alcohol. So for these folks that already have a relationship with alcohol, there is a time and a place for primary prevention, but here we should really be focusing on secondary prevention because we already have detected early use. And so now we want to jump in to prevent further use and provide some of these resources. So this often means that we are working to understand why a person is using substances in the first place. Yes, great question, Isabel. This comes from ACHA, so large data sets that come out of college campuses every 2 years. If you're interested, I can share more in the chat, or maybe one of my colleagues can plop the executive summary in the chat. But this data here comes from the fall of 2023 data set. Thank you, Dylan. I see he's going to do that for us now. Great question, though. Thank you so much. So often, though, when we're focusing on secondary or tertiary prevention, we want to understand why a person is using substances in the first place. So motivational interviewing can be a great tool for secondary and tertiary prevention, and we're going to go into that in just a second. Again, sometimes we can see that these types of prevention correlate with age, other times not, right? There are very much people that never use substances, right? Primary prevention works, quote unquote, for them, and they never need secondary screening or interventions, or secondary screening and interventions and reduction works, and we never need tertiary prevention methods, but not necessarily across ages like that. Okay, something that I want us to be very clear on here, though, is thinking about what we are trying to prevent specifically, right? So again, as we apply this prevention pyramid that was created for chronic disease onto substance use disorder, are we trying to prevent substance use in the first place? Are we trying to prevent substance use disorder, addiction, negative health outcomes? Specifically, what are we trying to prevent? And then how do we adjust our prevention perspective accordingly, right? So I shouldn't be using tertiary prevention if someone hasn't started using substances. I shouldn't be using primary prevention if I already know that someone has a high risk of overdose, right? Because of the ways that they're already using a certain substance. So really using the prevention perspectives to meet people where they're at. And this involves knowing where people are at and taking a really reality-based approach of, okay, based on the age range, I got to throw this away and recognize that this person is 12 years old, but they are here. Or this person is, well into their career, for example, but they are here, and being mindful of that. All right, folks, sometimes it's easier for me to think of the types of prevention as prevention before substance use begins and prevention after substance use begins. So I just want to jump into this a little bit here. Again, when we're working to prevent substance use from starting in the first place, it's actually a lot of health promotion. So our main goal here is either to prevent or delay the use of substances. We do this through bolstering people's holistic well-being, and I've got a slide on what options we have for this. We do this through protective factors, and we're going to talk about what protective factors look like. We do this through judgment-free substance use education, right? So one example of this that we use often with college students is ASTP, or Alcohol Skills Training Program. So this is an educational offering about the facts of alcohol use, for example. So what is the standard drink size? What is a person's blood alcohol concentration? What are the effects of alcohol on the brain and body? And then if a person wants to if a person chooses to use alcohol, how can they reduce their risk of harm? If a person wants to slow down or stop their use of alcohol, how can they do that, right? So these judgment-free offerings. And then certainly before use has begun, we are either preventing use from starting in the first place or delaying use from starting, right? If this is alcohol, maybe we're delaying use until a person is 21. In certain states, we're delaying cannabis use until 21 or ever, right? But again, I really want us to hone in on here of what does autonomy say about this? What does a person's individual choice say about this? And how can we work with this individual to understand what they want? So again, sometimes this can be part of developmental stage, but not always. One thing that is often part of developmental stages, though, is doing things that we're told not to do. So it can be really effective to give people the right conditions to self-govern, right? Helping people make healthy choices for themselves, but giving them the autonomy to do so allows them to make healthy choices in this moment when they are working with us, but also all of the prevention practitioners or substance use peer providers out there, for example, know that we can't, nor should we, try to control these folks' lives. And so what are the resources? How can we give people ways that they can effectively self-govern? Because we know that we're not always going to be here to provide screening, intervention, motivational interviewing, that sort of stuff. So we're also seeing more sober, curious movement to begin with, or just more substance-free people, right? And we love this. This is amazing. So we are seeing more of this promoting non-use for a lifetime is working, and it's also a cultural piece within our society. All right, friends, I then want to jump into talking about what are some of these protective factors here. We can see a large part of preventing substance use before it begins is really health promotion, is really bolstering protective factors. So what are some of these? Well, let's jump into it here. Okay, so in no particular order, again, healthy coping strategies. When we look at some of the research we see, and I'm going to show you all these in a couple slides, a lot of reasons why people report using alcohol or cannabis or whatever it is that they are looking to cope. They are looking to deal with an experience they are having. And so if we can offer people across life stages healthy coping strategies that work for them. So for some folks, this might be going for a walk to de-stress. For other folks, this might be life fueling connections. For some folks, this might be meditation or moving their body, right? This could be journaling. This could be going to therapy. So healthy coping strategies, can we promote this at a young age so folks know how to cope when life gets tough? Because we all know that life gets tough. Okay, a key protective factor for alcohol and other drug use is positive self-esteem. So when we love ourselves, when we feel confident in ourselves, we are more better able to refuse substance use. So use some of our refusal skills and also build other ways of having community, for example, or dealing with negative emotions that we might be having. Okay, family and community support, right? So these life fueling connections are really important as we are protecting ourselves and other people from substance use disorder. So do we have a family or a community? Family comes in many forms. Do we have a group of people who we love and who love us and who support us and we can talk to about these things? Do we have authentic relationships, again, that we know and we trust? These are very protective factors for all people, but especially for young people. Oh, thank you, Nick. I appreciate that. Okay, friends, next thing I want to note here is self-control and refusal skills. So refusal skills, being able to say no if a young person is at a social gathering and they are offered alcohol or other drugs, how can they feel confident and able to say, hey, thanks, but no thanks, and having that self-control to either not use if they don't want to or they know they shouldn't use, or use less, right? Being able to have control over oneself. Friends, something that I want to note here about family and community support is that we know that when parents have realistic conversations with their students, with their children, and when they talk about the realities of substance use in a non-judgmental way, that their students are less likely to use substances. So, years ago, there was this large conversation about, well, should we be taking the European approach, which is that students should start drinking earlier on so that they don't have so much of this feeling like they can't use drugs and alcohol and then using it a lot when they are able to. The research indicates that the more that parents talk to their young people about the education, non-judgmental education of alcohol and other drugs, and then the more parents set expectations, the better their students tend to do, rather than parents saying, hey, Jimmy, sure, use alcohol, just be safe about it. That is not a protective factor, right? Okay, let's shift into a key aspect for me and a key aspect when we are thinking about the lens of public health. It's having one's needs met, right? So I am not going to get on my soapbox here, but something that I feel really passionate about as a person that works across the team of care is that many times folks use substances to meet one of their needs that they have not found a way to meet otherwise, right? So if we think about folks that might be experiencing homelessness and we talk to them, a lot of these folks will share that they do not feel safe living on the street, or it's cold living on the street. And you know what helps when you're feeling a little cold or a little anxious? many drugs might help in that situation. Right? Or let's say having one's needs met, a worker that has been injured at work and is having back pain, and needs to go to work to support their family, having their needs met of being able to take some time off, having access to affordable healthcare, that's having their needs met. And that certainly can prevent self-medicating or high-risk use. Let's see, Megan is saying, I present to my 7th grade health classes every trimester in 4 schools, and we always do an activity on self-control and refusal skills by role-playing various scenarios. I love that, Megan. Okay, let's shift in then to talking about sense of purpose and optimism, right? So we know that when people have hope for the future, when we feel like we have a sense of purpose, when we have passion, that is beneficial. That is a health promotion factor there across lifespans, right? So young people, we talk a lot about this with people that are in recovery. Having a sense of purpose, being hopeful is a protective factor, either from starting substances in the first place or to protecting our recovery. Okay, identity exploration. We know that affirming people and loving people is cannot be understated, a large protective factor. So some data from 2022, Trevor Project research shows us that experiencing conversion therapy or efforts to change a youth LGBTQ identity to straight or to cisgender was associated with greater use of reporting regular alcohol use, regular marijuana use, and drug use. So again, loving people and affirming people is a effective factor. Okay, friends, let's shift in here then. One thing that I want to note too is that there are also key environmental controls. So potentially, depending on where we work, we might have access to this, we might not. It sounds like many of us are working one-on-one with individuals. If any of us are working in the community health department, for example, there are also key environmental controls. So taking a public health perspective, this would look like reducing the availability or accessibility of alcohol and tobacco. This can look like regulating sales. This can look like regulating advertising, right? So it is really hard for college students when we're working with them to either not use substances or to reduce their use of substances when they are on campus and they see that their basketball team is sponsored by Coors Light, or on the 4 corners of campus, there is a dispensary. This is really not in alignment with public health principles, because again, public health happens all around us. All right, let's then shift into talking about prevention after substance use has already begun. So we focus on catching people when they are young, but we know that we miss a lot of people. And also we know that older age does not mean substance use, right? Human development is not related to age, but rather age can't be the only determinant of how we work with people and when we work with people. So after we know, maybe, again, this would be if we know that 64% of college students are already using alcohol, these might be better options of working with certain groups of people. So after substance use has already begun, we are still promoting many things. We're still working in the principles of health promotion and public health. So what we really want folks to do here is reflect on their substance use. Why are they using substances? What are they trying to gain through the use of that substance? What alternative options might look like, sorts of thing. We are also working with harm reduction strategies. So across substances, if this is alcohol, okay, can you put food in your stomach if you choose to drink? Can you drink enough water? Can you always go out with a trusted friend? Can you never drive? All of those sorts of things. If this is cocaine use, for example, okay, can you test your pills, crest, and powders with fentanyl testing strips? Do you have naloxone on your person? Are you using with a friend? Right? Are there numerous ways that you are protecting yourself or reducing your or your loved ones or your friends or people you don't even know's risk of harm? We're promoting responsible and informed use, right? So folks knowing a lot of this with college students is working with people to know what their limit is, right? To know what a standard drink size is, to know how many standard drink size get them to their quote unquote buzz zone. For many of y'all, many folks in this room likely have a relationship with alcohol. We want to teach all people how to have a responsible and informed relationship with alcohol. Obviously, this looks different at different life stages, whether it is legal to do so or not. But working with people again on how they can use responsibly, whether this is not using it all or reducing their use. And then a large thing that we're promoting through public health principles after use has already begun is resources and treatment as needed. So early intervention, working with people, getting them to treatment if this is necessary, getting them to therapy if this is necessary, getting them to community, ways that they can bolster their community, ways that they can build some of these protective factors in their life. Okay, friends, a quick word here on motivational interviewing. So motivational interviewing is used through a lot of prevention, harm reduction and recovery work. And really it is simply a conversation style. It's used in therapy a lot, but it's really just a conversation style in which we can work with people to better understand their own motivations, and then to make changes in their lives. So we know that for humans, for all people, making a change is very hard. We know that when we're trying to make behavior change in particular, ambivalence is normal. And so with that, when it comes to making a change to our substance use, we recognize that and we work with people and we let them steer the car really under this motivational interviewing approach. So what are they getting out of substance uses now? What are they not liking out of substance use now? What are other things that they can be doing instead to get what they want, whether that's community, whether that's coping, sort of stuff, and then realistic goal setting. But really motivational interviewing is built off this foundation of autonomy, meeting people where they're at, compassion, empathy, non-judgment, all of the things. Friends, again, motivational interviewing is an entire either training program or part of curriculum. So we don't have time to go over all of it now. If you do want to, though, there are so many free resources on motivational interviewing. I really do encourage you to take a training course, though, because then you can practice your skill. It is hard to do motivational interviewing well. And so a lot of that is practicing with other practitioners. Anyways, if you're interested, send me an email afterwards and I can get you in touch with some of the training programs that I'm aware of. All right, y'all. Let's jump in then to some of our approaches over time. So I would argue that we have made a shift from this just say no approach that we have historically seen in the 60s of this is your brain on drugs, or just say no to drugs and alcohol, right? The DARE program. We have seen it shift to an educational program, right? So if people just knew better, they would do better. And yet we very clearly know now that education does not equal behavior change. I'm going to say that again, because education is one of the easiest things to offer, but education does not equal behavior change. Education can provide tools to help people change their behavior and to understand what alternative choices might be. But education should not be used to limit the amount of choices that we give people, right? So we have really shifted from just saying no to education to now incorporating education with discernment, understanding the why people are using substances, what needs are they trying to get met, and then providing alternative options. Okay, we had to here, of course, because you got to throw back to the 60s. I want to take a quick minute here to make a note on our approach to prevention historically. Throughout history, we have seen judgment used either intentionally or unintentionally as part of our substance use prevention and education practices. So many of y'all throw in the chat if you remember this. This is your brain on drugs, a fried egg, right? It was stigmatizing. I'm not sure if Nancy Reagan was aware of this at the time. Okay, so some folks are saying this was the 80s. Thank you. This was before my time. Yep. Sorry, friends. I'm getting Nancy Reagan and the egg approach mixed up. Anywho, but many folks remember it here. So we now have to recognize that the ways that our approaches have contributed to stigma for those that experience substance use challenges. So this is your brain on drugs, or some of these underlying themes that we may have noticed of we need to protect kids from people who use drugs. This has really worked to heighten the negative stereotypes of people who do struggle with their relationship with substances. So it also, we know, greatly reduces a person's ability to reach out for help when they need it. it is important then to amplify the facts and to amplify choices without strengthening fear and othering folks. We can't undo the harm that we have done of using stigma and judgment to prevent substance use disorder. Not only does that not work, shame is not an effective behavior change motivator. So not only does it not work, we have done a disservice to those of us working in harm reduction and recovery, because there is a lot of stigma that we need to clean up now. Okay, so all of this to say, we are still doing prevention through these public health perspectives. We're just doing it through a slightly different lens. Okay, friends, I'm going to jump in then here. Hopefully this is review, but why do people use substances? Just for the sake of time, I'm going to go over that. We know that people use substances for a multitude of reasons, right? Whether that is to fit in or belong, to feel like they are part of something, to do better, to improve maybe their the way that they're performing in school or the way they're performing at work, right? Whatever, to do better, to feel better, to feel good, whether this is feelings of euphoria or to feel normal if they are struggling with a mental health condition, right? Curiosity, certainly, especially when there is so much substance use portrayed in media and in culture. People are curious and people use substances to feel better. Okay, but an important note here is that if we haven't solved these needs, we can't ignore the realities of substance use. So I really want us to encourage rethinking, which I think most of us have, right? Substance use is not a moral failing. It is adaptive coping. So we can understand that substance use, people are using substances in potentially high-risk ways because they feel that they need to, or they haven't been given the right coping skills or the right education or the right person to talk to. So I encourage us to always take the more compassionate approach, right? Shifting our thinking from, we've done this, I think, predominantly. Substance use is not a moral failing. It is not a moral issue. It is a public health issue. And it's adaptive coping. So I'm just going to make sure I'm up to date in the chat. I think so. I remember this commercial. I can tell I'm talking about the clients in treatment. It would be great if this recording was sent out. No worries, we will absolutely do that. Okay, friends, so thinking about some of this adaptive coping, I'm going to share quickly research that is a couple years old at this point. So I conducted this research on a college campus in 2020. So I do want to be mindful that most of this data comes pre-pandemic with traditional age college students, 18 to 21, 22 years old, but we can expect to see similar motivations today. So again, this is research that I conducted in 2020 with 941 college students. This did not seek to address or seek to understand how many folks were using cannabis. It really just wanted to work directly with those folks that had a relationship with cannabis and say, hey, why? What are you getting out of it? So we can see here, similar what we already know to be true. 80% of these college students said that they were using cannabis to be social, to have fun. So from a prevention perspective, what are other ways that we can provide this fun and this social time that students are looking for? I would argue we shouldn't be creating this. We should be partnering with students to create this for themselves, because I, as a millennial, have no idea what current Gen Z or Gen Alpha think is fun, right? Okay, 25% of students who use cannabis say that they used it to relieve pain. This is 1 in 4 college students are adaptive coping. They have pain and they are taking it into their own hands of how to deal with it. 46% of these students use cannabis because they are using it to sleep, right? How many of y'all have trouble sleeping? Sometimes it can be really hard to sleep as a human. And so again, students are taking this into their own hands. Students use cannabis to feel less stressed, 71% of them. So what are ways that we can work with folks to be less stressed? Is this meditation? Is this community support? Whatever, healthy environment. 40% of students who use cannabis said they use it to relieve anxiety. And 26% of students who use cannabis said they used it to relieve depression. So we can see here the motivations for folks are often just parts of the human condition. I want to jump in then to talking about the social determinants of health. So again, this is a key public health concept. We're doing the abridged version today, friends. But really, we know that a person's experiences greatly impact how and why they will choose to use substances. So social determinants are really the conditions and environments where people are born, where they live, where they work, where they play, where they worship, and the age that affects folks' health, their functioning, and their quality of life, right? So we understand that all folks have different social determinants of health. Our economic stability, how much money we have greatly impacts our health. Maybe I am able to afford healthier food options. Maybe I'm able to afford living further away from a freeway that I know is impacting my young person with asthma, right? So money cannot be understated as how it impacts our health. Education and access and quality of that education, right? Making informed decisions and having knowledge is a privilege when it comes to health, healthcare access and quality, right? Do I have access to good healthcare options? Potentially this is because of where I live. Am I in a more rural area? A lot of this too, though, in the United States is, can I afford it? Is this going to put me into bankruptcy because I need to go to treatment, right? Okay, neighborhood and built environment. Our environments play a large role in our health, whether this is where we live, our environmental wellness, our neighborhood, how folks in our neighborhood are talking about alcohol and other drugs, for example. This plays a large role in our health. And then last but not least, our social and community context. So do we have healthy support systems built in? Do we have places we can go, people we can talk to, et cetera? Okay, I'm not going to give the exact school, but I will say that it is a small to medium-sized school in the Pacific Northwest. So we can see the context there of cannabis being legalized in the PNW. All right, let's then, friends, shift into talking about some holistic prevention practices that we can take. So if we're thinking about this holistic approach, there are a couple things we can do, right? And a lot of these might be in our control. Many of them might not be. First would be affordable healthcare, right? So if this is preventing chronic disease, if this is preventing mental health conditions that we know disproportionately impact a person's likelihood of using drugs or alcohol or coping with drugs or alcohol, affordable healthcare is a wonderful, holistic way of practicing prevention. Again, this may or may not be accessible for us to offer to the folks that we aim to serve. Community and sense of belonging. For young people across life stages, this is crucial. We see the impacts of people that have healthy support systems. Even the more people that you talk to in a day is correlated with better health outcomes. Okay, affordable and safe housing. Do you have a safe and stable place to live? This is a wonderful holistic prevention perspective. Empathy for the human condition. Can we understand some of the reasons why we know folks are choosing to use drugs, cannabis, alcohol, whatever, painkillers, whatever it might be? Can we understand, can we ask the why? Why are you choosing to do this? What's going on? Authentically, non-judgmentally, hey friend, what's going on? Rather than thinking of this as a moral failing or pushing people aside. A lot of holistic prevention is using motivational interviewing. So understanding that change is hard, providing people resources and ways that they can make reality-based changes in their life. Access to affordable mental health promotion and treatment, right? So can mental health promotion be integrated into all that we do from a young age rather than, okay, you're struggling with your mental health, you go to therapy. Can we bolster mental health from the beginning? And I know many communities are doing a better job at this. And then last but not least is certainly this trauma-informed care. Can we understand that the human experience is hard and many folks have things that they are working through or potentially self-medicating from? So this is being really realistic and also very much it's partnering. It's understanding what resources do I have, what resources do I not have, and then partnering accordingly. I also want to be mindful here that sometimes being a practitioner in this world feels daunting because how many of you, for example, are social workers or therapists, and you know that if you could just magically change your clients' conditions, a lot of their challenges would improve. So I want to be mindful that there is a lot that we can do. There is also a lot that is on a systems level that is challenging, and we need a lot of partnership with. I want to be mindful here, though, that prevention is also opioid overdose reversal medications, as many of our friends have said. It's also educating people on how to prevent or respond to overdose. And public health prevention is also safe syringe services to reduce the risk of infectious disease like HIV and hepatitis. So prevention really needs to be holistic. All right, y'all, simply for the sake of time, just a reminder here that well-being requires a holistic approach that addresses the multiple facets of our health. Really, we used to think of health as just our physical health or our mental health. Now we know health across these 8 dimensions of well-being. So, for example, sometimes when folks are struggling with their occupational health, we normalize, you come home from work at a hard day and you crack open a couple beers and then a couple more beers because you really hate your job. Okay, holistic prevention is saying, what's the problem here? Rather than taking the beer away, it's saying, what's going wrong with your job and how can we seek to address that? Or if you're emotional health, if you're struggling with anxiety, how can we address that rather than what you're using to cope with your anxiety? All right, friends, last but not least, of course, are taking this reality-based prevention perspective. So it's important to know that alcohol and other drugs are deeply ingrained in our culture. And so we need to be mindful of that. And we need to be mindful of the ways that this is showing up in young people and all people's lives. So if we're taking this reality-based approach, we are using evidence-informed approaches that are grounded in people and their experiences, right? So a lot of this is understanding what people's experiences are. This might be through focus groups, working with people in your community, young people, older people in your community, and understanding what their experiences are, and then being evidence-informed in your approach. Reality-based prevention is being honest, it's being non-judgmental, and it's being practical about what can we do and how are we going to do it. Public health prevention and reality-based prevention needs to be built off the foundation of respecting autonomy, right? Humans have choice. We cannot make all choices for other people. And so it's beneficial for us to work with people to make their own set of informed choices. This reality-based prevention includes the use of realistic goal setting, right? So are we using primary prevention? Are we using tertiary prevention? Where is a person at? Meeting people where they're at rather than where we want them to be. And then recognizing that our culture, again, and the determinants of people's health mean that some people are inherently disenfranchised in what they have access to, and we need to work to address that. All right, y'all. As we wrap up, I want a call to action here. So what can we do about this? Well, as we know from a public health perspective, we are always focusing on what is underlying and we are working to catch it upstream. We are working to prevent things from before they occur. So yes, we'll send out the recording of this and I can work to give y'all access to the slides, but a lot of that is that protective perspective. So how can we protect folks from some of these negative health outcomes that can also prevent substance use? We're focusing on what's underlying, whether that's mental health, whether that's a person's lack of environmental wellness, whatever. We are promoting judgment-free educational offerings, and we're providing access to honest and supportive conversations, right? In an age-appropriate way and also in a developmental way. So the conversations that we're having with K through 12 students, really, I would argue K through 2nd grade students and then 2nd grade through 4th grade students, right? Like this needs to be age appropriate, it needs to be based in where the students are at geographically, what they're exposed to. We have to be tailoring our prevention approaches, but can we provide this judgment-free educational offerings? And then can we provide access to honest and supportive conversations, either peer-to-peer, peer to professional, whatever that looks like and whatever we have access to in our communities. We are also providing tools needed to manage the reality of substance use, and we have to recognize the role of our culture. Again, so working on a college campus, it can be really challenging to tell students, hey, don't use alcohol, and then they leave and they go 1 block over and they see their own basketball team being used to promote Coors Light, right? So we have to recognize the way that our culture is also impacting this. And then last but not least, friends, we have to refuse to allow fear or judgment to direct our approach. Again, we love and we support folks that are using harm reduction either as an approach to recovery or just because that is what they choose for themselves. We know and love people in recovery, and we can't walk back the stigma that has been created by some of the judgmental approaches. It is easy to use shame as a behavior change motivator, but it is not effective. All right, y'all. Woo, that was a lot of talking in an hour. Thank you for bearing with me. Thank you so much for friends that gave their thoughts in the chat. I really do appreciate it. Please do look this over because, as I said, y'all are truly the experts. And if you can partner or share knowledge with each other, we love to see that. We're also here. A lot of what myself and our team does is provide free consulting to folks that are interested. So if you're working on a college campus, if you're working with young people, if you want to learn more about public health, or you're interested in some of the resources that I had shared today, send me an email. My email is sydney@safeproject.us. With that said, thanks so much. And I'm going to pass it over to Rana to close us out.
Super. Thank you so much, Sydney. That was incredible. You did a really great job. A couple of housekeeping things. It was asked several times whether or not this information will be shared. I just want to remind you that indeed you all will receive a recording via email as along with a certificate if you attend the session today. We do want to invite you to stay tuned for future presentations. We're hoping to have another prevention perspective webinar series offered during National Prevention Month in the October timeframe. We do invite you to share with us if you have ideas for future topics or areas of interest. Our contact information was shared right here on that slide, so feel free to reach out to Sydney or myself with any questions, with any ideas. We'd love to hear from you. We'd love to keep the conversation going and keeping the thread of connection out there, because we do know that prevention is better together, and we definitely want to be your partners in this great work. Last but not least, do want you to know that there is a survey. We'd love to hear from you. We want to know what your thoughts are. Please use the QR code that's on this screen. Take the survey. Your feedback is invaluable to us, and it will allow us to do only a better job in the future. So thank you so much again for carving out time and sharing an hour of your day with us. We truly do appreciate it.